And joining me now for more details is Professor Ranjit Rye of the OCTA Research team. Professor, thank you so much for joining us. Why is OCTA Research recommending that Metro Manila residents be vaccinated first, as COVID-19 and its variants are raising infection rates?
Well, let me clarify that. If supply is provided, and we all know that supply, the bulk of the supply will come at the end of the year. If we have limited supply and there is still a manageable situation as far as the surge is concerned, some of the scientists in our team are saying, given that majority of cases, 70% of cases are in the NCR and Calabar zone, the priority should be placed in vaccinating this particular geographic spot. Given that we have a limited amount of supply of vaccines, the reason being, at least in the argument, and this is a big debate in our group, is that while risk is an important foundation for deciding who gets to be vaccinated, that means health workers, members of the vulnerable groups like the elderly, while that's still important, that priority should be kept. Geographically, the pandemic is centered around key geographic areas in the country.
Professor, the epicenter right now is in Metro Manila. If we have the supply, we're expecting a large amount of vaccines to arrive next week and in the first week of April. And with the 12 million residents here in Metro Manila, how many percent do you think should be immunized to have some sort of herd immunity in the capital region if we have the supply?
Something like 3 to 7 million people should be vaccinated in the areas of the NCR and Calabar zone. And that's assuming we have the supply. The argument being that if we can reduce incidents here, it's like a snake. We cut off the head. No, I'm sorry if there's snake lovers in listening. No, but if we understand the pandemic to be a monster, a leviathan, no, and the head is the important part. The NCR and Calabar zone is the head, and if we can deal with that, we could, in a sense, slow down the pandemic significantly.
But how soon, in your view, should this strategy be implemented if we have the supply?
Well, if we have the supply, if we have 3 to 4 million doses, then I would think as soon as possible. Of course, this is something that is a proposal for consideration of the IATF.
Do you think the IATF and the government will be flexible with this idea to inoculate Metro Manilans first, reallocate some of the vaccines in the provincial areas that have low infection cases to Metro Manila?
Well, my sense, Rico, and this is I really don't know, honestly. My big focus now, and I think the big focus of your show and everyone, is that how serious this surge is. I don't think we can implement a effective deployment of our vaccine in such a context. That's why we have to deal with this surge now. We have to deal with it effectively. We have to deal with it quickly. This is the message OCTA is trying to push. No, if we need to decide on more, stricter quarantine status, we should do so. We should do so now, while the situation is still manageable. Right now, it's raging. We're in a serious phase as far as this surge is concerned, and I'm not certain that everybody is taking this surge seriously.
So when you're saying, Professor, stricter quarantine measures, with what is being implemented right now in Metro Manila of barangay lockdowns and curfew from 10 in the evening until 5 in the morning, this is not sufficient. Is a shift back to modified, enhanced community quarantine the best solution, maybe for, let's say, 2 to 3 weeks?
It would be. Of course, government employees and private sector employees will have
Okay, we're experiencing some communication issues with Professor Ranjit Rye from the OCTA Research Group. And he says that if indeed we have the supply of vaccines, most probably Metro Manila residents could be prioritized in terms of vaccination because this is indeed the epicenter of COVID-19 and its variants. Hopefully, we will have Professor Ranjit Rye if we get communication lines fixed up later during the program. But first,
Hello?
we will... Professor Rye?
Yeah, I'm here. I'm sorry.
Okay, you're now back. Okay, it was a bit garbled, our communication lines.
I'm sorry. Yeah, you know what OCTA is trying to suggest, and this is of course a proposal that has to go to IATF and should be cognizant of the importance of livelihood, and of lives at the same time. Is that if we decide, and we need to decide on a stricter quarantine, this strict quarantine, whatever you call it, will have to have transportation so that our own workers are able to move from their homes to their workplaces. It should have as many establishments open during this quarantine period, and that while we could have flexible, while we have the quarantine, flexible work arrangements should be made for the public sector as well as for the private sector. If we can encourage the private sector to have their employees work from home, then that would be good. So we're envisioning a stricter quarantine where we have massive mobility restrictions.
Okay.
So, for example, social gatherings would be completely prohibited. There's no 5-person, 10-person. So, and we have to do this for 2 weeks.
Okay.
And of course, some establishments will need to be closed down, where super spreader events could happen, like indoor dining and all of that. But as much of the business establishments as possible that hire many of our employees and their workers should be open. Okay, we want this new and harder GCQ, we call it a hard GCQ, to be kind to our workers. So that's why transportation is an important issue for us. But mobility has to be restricted. Just following the public safety protocols may not be enough to slow this thing down. So government has to decide, but it has to decide now. Okay.
All right. Thank you so much for your insights and for those recommendations, Professor Ranjit Rye from the OCTA Research Group.